Good evening, and welcome to What Next? Reproductive Justice in a Post-Roe Nation. My name is Felicia Salinas Moniz, and I am the director of the Sarah Doyle Center for Women and Gender, which is part of Campus Life Engagement within the Division of Campus Life at Brown University. This event is a collaboration with the Pembroke Center for Teaching and Research on Women and is part of the Sarah Doyle Center's new Gender Equity Speaker Series. We are delighted to have Drs. Zakiya Luna and Sara Matthiesen in conversation with Dr. Sarah Williams. Before I introduce each of them, I will share briefly the agenda for this evening. Drs. Luna and Matthiesen will begin with introductory remarks, followed by a moderated conversation with Dr. Williams. Participants can use the Q&A function at the bottom of your Zoom screen to pose questions throughout the conversation, and the panelists will take time towards the latter half of this program to answer as many audience questions as possible. This event is also being remote captioned, which you can enable at the bottom of your Zoom screen where it says CC. Special thank you to our co-sponsors, the Center for the Study of Race and Ethnicity in America, School of Public Health, and Departments of American Studies, Anthropology, and History. And now about our esteemed panelists. Dr. Zakiya Luna is an Associate Professor of Sociology and Dean's Distinguished Professorial Scholar at Washington University in St. Louis. Her research, teaching, and community work focus on social movements, reproduction, human rights, and intersectionality. She has published multiple peer-reviewed articles and chapters and secured multiple grants, including the National Science Foundation. Her research on the reproductive justice movement includes the book, Reproductive Rights as Human Rights, Women of Color and the Fight for Reproductive Justice, which was recently included on the Oprah Daily List, the 12 books you need to read post the Supreme Court's Roe v. Wade smackdown. She is co-editor of Black Feminist Sociology, Perspectives and Praxis with Whitney Laster Purtle. Professor Luna earned a joint PhD in Sociology and Women's Studies from University of Michigan, where she also earned a Master's of Social Work. Dr. Sara Matthiesen is an Assistant Professor of History and Women's Gender and Sexuality Studies at George Washington University. Professor Mattiesen's first book, Reproduction Reconceived, Family Making and the Limits of Choice After Roe v. Wade, shows how incarceration, for-profit and racist healthcare, disease, parentage laws, and poverty were worsened by state neglect in the decades following Roe. Reproduction Reconceived reframes the decades following Roe as a labor history of family making to offer an urgent account of the labors families were made to expend simply to survive in the face of state neglect, and of the costs that pile up when family making is regarded as a private responsibility rather than a public good. Professor Matthiesen is currently at work on a second project titled Home Abortion After Roe that traces the persistence of lay abortion care provision and mutual aid support networks after legalization. She earned her master's and PhD in the Department of American Studies at Brown University. Our moderator this evening, Dr. Sarah A. Williams, holds a PhD in medical anthropology and is currently the Louise Lamphere Visiting Assistant Professor of Anthropology and Gender Studies at Brown University. Her research is focused on reproductive health and rights in Mexico and Canada, with a particular emphasis on reproductive justice approaches to maternal health care and Indigenous reproductive rights. Her work has been featured in Social Science and Medicine, Women in Health, and the Canadian Medical Association Journal, and she is also a doula and advocate for evidence-based birth practices. Please join me in welcoming our panelists, and I will now turn it over to Dr. Sarah Williams to get us started.
Thank you for that introduction, Dr. Salinas Moniz, and welcome to all of our participants today and our distinguished panelists. On January 22nd, 1973, the US Supreme Court announced its decision in Roe v. Wade, ruling for the first time that the constitutional right to privacy was broad enough to cover a woman's decision whether or not to terminate her pregnancy. Even before this decision, states had generally been moving towards decriminalizing and loosening restrictions on abortion across the country. But Roe made outright abortion bans unconstitutional. Of course, as we know, this right was almost immediately and continually challenged, And over the decades, a variety of strategies were employed to chip away at this right, or to make it functionally impossible for some pregnant people, especially those who are impoverished or rural, to exercise. In spring of this year, the leak of the Alito draft opinion in the Dobbs versus Jackson Women's Health Organization Supreme Court case provided advance warning that what many of us had feared and anticipated for years was coming to pass. And on June 24th, the Supreme Court overturned both Roe v. Wade and Planned Parenthood versus Casey, ruling that the US Constitution does not protect the right to abortion. In most states currently, abortion remains legal to some extent. However, trigger laws and post-Dobbs legislation has made abortion illegal except in cases of imminent maternal death in 12 states, legally unclear or lacking providers in 2 states, and restricted based on gestational age in many others. In just a few short months, we've witnessed incredible suffering caused by the Dobbs decision. Rape victims as young as 12 struggling to access permission to abort, maternal deaths and maternal morbidity due to sepsis from non-viable fetuses, pregnant people forced to travel thousands of miles to exercise their human right to an abortion, and the insidious erosion of the personhood of people with the capacity to become pregnant, as hospitals, physicians, and pharmacists go beyond state laws to restrict access to life-saving and life-improving prescriptions, with the excuse that a patient's anatomical potential for pregnancy is justification to deny treatments because these could be used as abortifacients. But as critical as the protections outlined in Roe were for people with the capacity for pregnancy in the United States, abortion rights are just one of a plethora of reproductive and human rights that are essential for all people, and not just those protected by socioeconomic or racial privilege. It's within this context that we welcome you all into this conversation, where we'll be placing Roe, Dobbs, and abortion rights within a broader and more expansive vision of what honoring human rights in reproduction in our communities can look like and achieve. Through our focus on reproductive justice tonight, it's our hope that we can provide you with an alternative cartography of where we sit now and a roadmap to a future in which we are, all of us, more free. Without further ado, I would like to warmly invite Professor Zakiya Luna to open our discussion with a brief overview of your work.
Thank you so much for that introduction. I wanted to thank my fellow panelists, moderator, all the staff who've been putting this together, and all the attendees. And also just a very brief land acknowledgement. I'm on Missouri right now, and I'm in the land of many groups, including the Osage people. So I just want to also acknowledge that. I will tell you a little bit about sort of how I'm approaching this. And before we go too far, though, I do want to say that the definition of reproductive justice that I'm using is based in the work of Sister Song Women of Color Reproductive Justice Collective. And it has 3 components that are both simple yet quite complex, which we're going to talk more about. But in particular, thinking about the human right to not have children, human right to have children, and human right to parent children that we have with dignity. And, you know, now when you look up definitions of reproductive justice on your preferred search engine, usually what appears either first or maybe second or third, but usually first is a definition from Sister Song, right? That very definition. And the linking of human rights and saying that reproductive justice is human rights based is often repeated in different academic articles or sometimes in movement spaces. And when I first began really thinking about reproductive justice more from a sort of academic perspective, I really had questions about what does that really mean? Because in the areas that I was in, civil rights really was sort of the dominant mode in which US movements were generally making sort of progressive claims, and particularly movements that were deemed broadly successful, like the US civil rights movement. So the use of human rights seemed particularly unusual. And so I started my project really wanting to know like why contemporary social movement would be really interested in human rights, particularly because the US government has historically been at best neutral and sometimes actively hostile to the idea of human rights, which is often associated with rights over there and internationally. And I had the pleasure of coming across Sister Song through a different project I was on and noticed that they were really doing this innovative work and wanted to understand more about how Sister Song was creating this links through its coalition, what it really looked like in practice, and how successful Sister Song was at it. And to answer these questions, I did work archival research and interviews with movement leaders and participants, and then eventually some participant observation. And what I focus on is really highlighting what I refer to as like dual domestication, and how the US government's relationship to human rights is really one in which it really tries to restrict the meaning of human rights to fit within the contemporary legal framework that in the US really focuses on civil rights and political rights, like voting rights, and doesn't really draw attention to social and economic rights. Yet you have coalitions like Sister Song that were really trying to expand human rights understanding within the US context to include this panoply of rights and what I called revolutionary domestication. I will note, in case folks didn't know, that last week, Sister Song's co-founder Loretta Ross was secured a MacArthur Genius Grant, which, while she wasn't the only person to create the phrase reproductive justice or wasn't the only person who created Sister Song, I think many people would agree that she was really key in trying to keep human rights within reproductive justice. And something I think is really important, though, particularly as we're talking about movements, and particularly in this moment, is that it's not just about what movements are fighting against, it's what you're fighting for. And I think that's what was so innovative, and also seeing in practice at different events what was happening. And that's why I actually start Reproductive Rights as Human Rights, my book, with a vignette from a Sister Song conference to really show the space of celebration and really how folks were not just thinking theoretically about what does it mean to achieve human rights and therefore reproductive justice, but what does it mean in practice? I'm gonna leave that there. Thank you.
Hi, everyone, and thanks to everyone who has made this come together. And it's really a pleasure, especially to be in conversation with Professor Luna. We've followed each other's work for a while now, and it's good to be here together. So, in thinking about how to sort of give an overview of our respective work, I wanted to talk about how I came to what would become the dissertation and then the book, Reproduction Reconceived. And I was in graduate school. I started in 2009, and around the time I was supposed to be coming up with the dissertation idea, it was 2011, and that before 2021 set the record for the number of restrictions placed on abortion access. 2011 had that distinction. And that ignited partially, maybe some of you who are old enough remember, the discourse of the war on women that sort of took over Congress. And that was sort of the language that Democrats were using to indict Republicans and other anti-abortion legislators who were enacting those restrictions and also trying to keep the contraceptive mandate out of the ACA. At the same time, I was following the work of a reproductive justice organization in Western Massachusetts that was providing doula services to pregnant women and people incarcerated in a women's prison up there called Prison Birth Project. And I actually brought them to Brown through the Sara Doyle. at one point while I was in graduate school. And so I think I got really curious about the vast distance between a national conversation that defined a war on women, quote unquote, as restricting access to the tools required to prevent childbirth, and the local projects that I was seeing really grounded in a reproductive justice framework that were trying to make family possible for those living on extreme margins of society. And that really encapsulated the, the second and third tenets that Prof. Luna just outlined for everyone, of the right to have children and raise children with dignity. And so I started thinking about this distance by a return to Roe. Roe is often symbolized as inaugurating a period of reproductive choice in the US. And we know the limits of the choice framework, the idea that, if choice exists sort of in the abstract, but there's a bunch of barriers to you exercising those range of choices, that choice kind of exists quite mostly only in theory. I think we've become very accustomed to the idea that that is the case that applies to abortion. Even before Roe was overturned, access to abortion was severely restricted for a number of years. And so the idea of access as a more accurate descriptor for thinking about abortion rights, I think, has made a lot of headway in mainstream conversations about reproductive rights. But the idea that choice was also a problematic way of thinking about the ability to have and raise children, I think, was less familiar. And so I wanted to look at the other side of the choice equation, which was, to put another way, Roe also transformed the way that Americans thought about having children, that it helped us think about having children as a choice. And if you sort of failed in any way in that project, then the ramifications of that choice were yours to bear alone. And what came out of that was a project that, as Dr. Moniz just described in my bio, is a labor history of family making under what I call state neglect. So the idea that the state sort of retreated from the responsibility of having children and helping make sure they are raised in safe and healthy communities, that retreat and an expansion of various inequalities happened at the same time that Roe supposedly inaugurated this widespread reproductive choice. And so the book tries to give that history to kind of puncture the myth of choice that surrounds the idea of having children, and to show that state neglect does not produce an abundance of choice, but actually severely contracts it. And also, in the absence of any robust state support, has a really severe and deleterious effect of having families having to perform more and new kinds of reproductive labor simply to sort of survive, to maintain familial ties in the face of immense constraints, that we can talk more about in the Q&A. But I was really interested in how to close that distance between a national conversation that saw reproductive rights as solely about limiting childbirth and pregnancy, and a really robust grassroots movement grounded in reproductive justice that was trying to make family possible in a variety of places that, to me, Congress seemed very uninterested in looking at. So that's the origin story of the book, and I'm happy to talk more about it.
Thank you so much, both of you. So to kick us off with the questions, I'd like us to open discussion with thinking about why does abortion so dominate the discussion about reproductive health and rights and women's rights, especially in the United States?
We haven't sorted out how to decide who goes.
No, well, I'm laughing a bit because I mean, we had some pre-conversation around this, and then we also had some additional questions. And what I wrote from the answer on that was blurred, which is not invoking Liz Lemon and reflecting my slightly cold, addled mind. I mean, I think it's a really, on one hand, like a complicated question. On one hand, on the other, it's semi-simple. And it just happens that this week in my race and reproduction class, as we continue our discussion about reproduction and loss, last week was around miscarriage and stillbirth and all that, and this week is around abortion. And I'm just reminded of the Rosalind Paczewski quote that I just had in class around abortion being a fulcrum, right, for lots of meaning regarding women, motherhood, gender, and the state, right, and particularly young women's sexuality. And that was from the book of the 1990s, right? Like abortion represents a lot of different things. And women and gender expansive people's bodies represent a lot of different things, right? Sometimes being so representative that you actually miss the fact that there's like material bodies experiencing it. Some of the conversations are so abstract. You would not know that there are people who are, sitting in clinics trying to access care and being told at the minute, like, oh, the law just changed. We're sorry, we can't provide you services, right? So that is both the simple and complex answer, right? And then, of course, abortion is also very much about class. It's also very much about race and resources, essentially, right? And this broader question of how people make families and how they do that within a context in which the government has quite a bit to say and not say about that. Right?
Yeah, and I would add, I mean, I echo all of that. And in thinking about this question, I sort of interpreted it as, why does Roe loom so large in the reproductive rights arena? Like, why is it considered even I think still in mainstream discussions about the women's movement or feminist efforts or reproductive rights, that Roe is treated as like this end all be all. And I think part of the reason for that too is partially that, Roe was a legal victory. And in the US, we have a tradition of treating social movements are considered successful when they get recognition from the courts. So that's kind of our primary metric of deciding, like, when did a social movement demand get met or was successful, which of course, I think everyone on this call would agree that there are many more metrics for which we could sort of define success, but that's how wins become legible. And it also enshrined abortion as a negative right. So by that, I mean, the government doesn't, as we see 3 years after Roe's decided with the passage of the Hyde Amendment, which cuts off federal funding for abortions and has been, attached as a rider every year since, the government doesn't need to do anything to help you exercise the right to abortion. It just needs to stay out of your way. That's sort of what legal scholars mean when they say negative rights. Of course, we have seen how that even gets distorted, and there's a lot of things standing in people's ways trying to access abortion. But at least initially with the Roe decision, that was what the right to privacy was understood as was, okay, the state is not obligated to help you exercise this right, but we just can't stand in your way. And also American jurisprudence has a very strong history of negative rights. And so I think that has helped to elevate Roe and abortion as seeming like the most obvious or important wins when it comes to women's struggles in the feminist arena. And that is also because just liberal feminism exists has a much is amplified by mainstream news and media reporting and people who have prominent positions. So there's also some just like social movement reasons, I think, that it has remained so visible.
Thank you. So Professor Luna, in your work, you describe how the United States has engaged in a policy of restrictive domestication of human rights as a part of cultivating American exceptionalism. What has the impact of this orientation against domestically recognized human rights been on reproductive rights in the US?
Yeah, so I think first it's important to think about like human rights. There's the general way people refer to human rights, and then there's ways that governments and legal scholars also are thinking about human rights. And we're not going to get into the whole history of like the development of the United Nations and all of that, on whether or not can we find pre-UN human rights, but often within the US, like human rights are associated with something that's needed outside the US, right? And how does that come to be? Well, there's very sort of crude delineation of human rights in which there's sort of first and second generation rights, which are civil rights and political rights. So voting rights, for example. And that's sort of like first, right? As in more important. And then the second generation rights are social rights, economic rights, cultural rights. So everything from thinking about like rights to organize labor, right? Things like rights to healthcare, these types of things, rights to family formation. And then you have other sets of rights as well, like developmental rights and sexual rights. And due to, essentially, international geopolitics, right? There's a sort of like splitting of rights, and you had countries historically like the United States that really focused on first rights, like civil rights and political rights, and countries, well, spaces like China and Russia under different names that focused on social and economic rights. And there's a long, interesting, complicated history that includes things like anti-communism, et cetera, right? Why the US generally sort of rejected this set of second rights. But that's built into a lot of even the sort of historically successful movements, right? Like the US civil rights movement, in which there was explicit conversations between US civil rights leaders and others about in which they were basically told, like, don't focus on human rights. Like, that's not the way to go. Even though, there were attempts to appeal to these international bodies. And what that meant is that in many movement spaces, right, people are, particularly because they're trying to seek change with the government, had to speak in those terms. And it's not that people didn't think that social rights were important or economic rights were important. In fact, people understood, right, on movement level, civil rights leaders and various others and radical movements, like understood economic rights are very important. But if you're going to try to work within a framework of getting the government to make concessions, right, there's limits to that. And part of that limit is that they don't want to talk about domestic human rights in this broad way. And in fact, if you go right now to like the US government website and you look up human rights, it'll take you to Department of Labor, Human Rights, and it's under Department of State, right? Department of State, Foreign Affairs. And what they talk about is democracy promotion. And this has been the case under multiple administrations, because people think, oh, this is just the Republican. Nope, this is Democrats too, right? And this is about sort of broader American exceptionalism and what it means to believe that the US has it all figured out and that it needs to promote democracy elsewhere and get others to get like voting rights, when we know here we actually don't have consistent voting rights. And there's relationships between voting rights and reproductive rights, as radical reproductive justice activists have been talking about for a long time. But what that means is that you really limit the scope for which a lot of people are understanding the possibilities for the future that they're trying to build. And that means that, you had people in reproductive justice activism who were saying like, hey, you need to pay attention to these other things. You need to pay attention to labor rights, economic rights, healthcare. Like this is all relevant to how people are making choices about abortion or otherwise, and including who really has choices. So that's a semi-short, and I say short relative to like a 300-page book that I wrote, explanation of how the US government sort of orientation towards, and really in many ways against, domestic like human rights has really impacted even just our imagining of what impacts reproductive choices, right?
Thank you. And I see some really interesting overlaps here with what Professor Matthiesen has framed in her own work as the state neglect of reproductive rights and health, which are just as important and devastating as active attacks on reproductive rights. Professor Matthiesen, what does state neglect of reproductive rights look like, and what are some of its ultimate impacts?
Yeah, so I think at the broadest level, state neglect, at least how I was trying to trace it in the book, part of what it looks like is turning structural inequalities into personal failings. And that happens by, as I was saying earlier, this retreat that I trace and other scholars have traced as the rise of conservatism happens in the late 1970s and solidifies with the election of Ronald Reagan. And then we see conservatism turn sort of transform into neoliberalism with the Clinton administration. There are important differences between those regimes, but they share a retreat on the part of the state from what we might call public goods. So any kind of public services, the idea of welfare support, public education, public health care, their state neglect was my way of kind of trying to put a different name to processes that people have written about, but that I really wanted to center on the issue of the ability to have children, raise children, create family in different ways. And the way that is a labor intensive and resource intensive endeavor. And without infrastructure, I guess in the era of, the Biden administration, we now call some people are referring to this as care infrastructure, which Republicans, totally made a mockery of, but things that would make the sharing of the labor and resource intensive endeavor of having and raising children, that making that a shared enterprise, making that a public endeavor to some extent. Instead, state neglect has exacerbated how family is structured in the US, which is that all care is privatized and kept within the family. So families are responsible not only for the basic elements of raising children and keeping familial ties healthy. So like sending, basic resources like food, housing, healthcare, extracurricular activities for children. Not only are they responsible for all of that, but they're also responsible for overcoming the kind of twin of state neglect, which is forces of state violence. So in the book, I talk about the rise of mass incarceration and what that does to family making. The Reagan administration's refusal to mount any kind of public health response to the HIV/AIDS epidemic in the early years, the ratcheting up of our for-profit system of healthcare and what that does to people's ability to achieve healthy birth outcomes, not to mention secure healthcare for their children thereafter. So there's a variety of places that the book tries to make state neglect visible. And something I really grappled with methodologically is like, well, how do you do that? How do you make the absence of something visible? And that is really why, I focus so much in the book on the labor that families were made to do to pick up the slack of where the state refused to intervene or play a role. Because absence, like if, that labor has to get done. If it doesn't get done, it means the dissolution of legal custody. It means the dissolution of family ties. It often can mean illness and death in extreme cases. And so if that labor doesn't happen, that sort of life-sustaining labor, then it has devastating consequences. And so the way that I try to indict really state neglect in the book is by very painfully at times tracing the different forms of labor that families were made to do, and also calculating the devastating costs that piled up when families inevitably met the limits of their community's resources. So the book is full, in my opinion, of very inspiring efforts on the part of families and their advocates to make ends meet and to intervene where the state refused. But there are always limits to our individual and community resources. We cannot always mobilize in the way that something like the largesse of government could. We're seeing this right now with things like abortion funds and mutual aid networks. I mean, there's been such a huge influx of funds into abortion funds, and still there's not enough to meet the demand. So state neglect was kind of my way of trying to really help us understand that structural inequalities are not, in fact, personal failings, and that people try to overcome those circumstances quite heroically. And there are immense ramifications when those efforts fall short, and that we really need to reorganize the way, our value system within society, the distribution of resources and wealth in our society, even the ideological sort of narratives we tell about what is a legitimate or an illegitimate family, if we want to get to a more sustainable and just place.
Thank you. So I'd like to pick up on the topic of mutual aid networks. So in recent years, we've seen what seems to me to be a really incredible increase in general public awareness about mutual aid networks and localized practices of community care. For people who've not been a part of mutual aid networks, especially before the pandemic, before the Dobbs decision, this can seem like kind of a radical new form of organizing. However, both your projects demonstrate the ways that mutual aid has actually always been a core part of reproductive justice and broader reproductive rights organizing. Could you share with us some examples of what mutual aid in reproductive justice has looked like over time?
I mean, I'll just say a tiny bit. And I appreciate the question being framed in that way because, as you said, sort of public awareness of mutual aid. But following up on what Sarah was just talking about, Professor Matthiesen was talking about, since mutual aid has been around for as long as state neglect has been around. So, I mean, that's one way to think about it. So it's not new in that sense. Yet it's also, I mean, in many ways it is radical in the sense that people do have to think about community. But also should that be that radical? And I think the fact is there's many communities, low-income communities, immigrant communities, communities of color that just historically, right, have not been able to rely or trust, right, that they would be provided for by the government, right? And that's important because then what does that mean? That means you're responsible for care and health and feeding, as Sarah was just talking about, of your own family. But also if you have this broader sense of commitment to community, broadly defined, and to not just surviving, but thriving, you will also support others because you understand your fates as linked. And now I'm getting into some big, but there's that element of it. And also that people's need for aid shifts, right? Right now, you might have more than what you need, and therefore you can actually support others. And at other times you may need support. And I even think of, like, we have long histories in Black communities, and others, right, of extended kin networks, right? And the ways that people would informally and sometimes formally, like, adopt other children, right? That people wouldn't necessarily traditionally think it was mutual aid, but, like, no, it's saying, like, we need to all pitch in, right, to ensure the health of this child and their broader family. And part of some of the innovative work around reproductive justice has also been saying, like, family looks many ways, and acknowledging that broader history, that, like, family has never really just been a nuclear family that could live on one salary. Like, barely anybody could do that in the US context, and that's fewer and fewer now. And so even just the broader thinking of it. And I think mutual aid right now, yes, got very sort of, and Sarah, you can talk about this more. And what's been interesting to see as well, though, has been the attention towards abortion funds, and also the shifting and ensuring in many spaces that abortion funds are working from a reproductive justice perspective. That wasn't like a charity model of someone calls and then, someone who's donated anonymously is, given money and yay. But no, like, actually, that it's important to think about this as shifting resources, as being radical, right? And talking about race, right? And talking about intersectionality, and talking about empowering people and understanding that people have the knowledge, they just need the support, and to move the resources in different ways, right? To get what they need. I'm gonna let Professor Matthiesen go.
Yeah, I echo everything Prof. Luna said, and it also, listening to you talk, it makes me think about, every successful social movement has had a mutual aid component. They go hand in hand, and so in many ways, I was not surprised to find the community mobilization efforts that I did when I was researching the book, because organizers understand that mutual aid is the way to help people to overcome the shame and self-blame that happens when structural inequalities are made into your own fault. Mutual aid is kind of an antidote to that. It is saying, this isn't charity, as Prof. Luna just said, this is something that you are entitled to because you are a human being, and because there is actually enough resources to go around if we were to fight for a radical reorganization of society. And so I think that mutual aid is deeply politicizing, and it's like an incredibly important part of any kind of social movement mobilization. And it's really exciting to see mutual aid being so, it was like the pandemic plus the overturning of Roe, I think, put mutual aid into the mainstream discussion in a way that I don't think it had been prior. And that's because people realize that, like, no one needs to read my book to understand state neglect, right? Like, the pandemic was a terrible lesson or introduction to that for maybe people who were not already familiar. And now we're experiencing it in the realm of abortion, but we've also been experiencing it in the realm of maternal and child health care, with maternal mortality rates and infant mortality rates. So there's a number of ways that it is a part of the world already, but I think it is on people's radar way more. And, abortion, just to like use this example of abortion funds that I think have been really in the mainstream of the conversation now post Dobbs. Abortion funds preceded Roe, and they had like a very robust history immediately following Roe, because the Hyde Amendment made them a necessity by cutting off federal funds. We only had 3 or 4 years of seeing what publicly funded abortion care looked like. I don't know. I think it's easy to throw around like the Hyde Amendment, but just to give people a sense of how drastically it changed the landscape. In 1977, Medicaid funded 300,000 abortions a year, and by 1997, it funded 300. So it is immense in its reach of like, and it kind of disciplines how we even think about what the state should provide. You know, I think it's difficult even to get people to think about like publicly funded healthcare, publicly funded abortion, because we've been disciplined in these ways. So mutual aid is an important antidote to that. And that's, you know, I can talk more about some examples from the book, but I feel like I've now gone on for too long. So maybe I will raise that I'll weave that into another question if I can be so skillful. We'll see.
So a common theme that we keep coming back to is really the ways that neoliberalism, that conservatism more broadly, and these approaches to the welfare state, state neglect, really kind of discipline, but also to a large extent destroy our imaginations of what's possible, of what we can expect from not just government, but our society more broadly, what our communities can and should look like. And so I think we perhaps see echoes of that in how a lot of the more mainstream public discussions of the Dobbs decision tend to frame the loss of the protections in Roe v. Wade as the most critical blow to reproductive rights in decades. And we see this continual focus on recovering those protections, but only those protections. So what do the principles and core goals of reproductive justice offer us to move us beyond just calls to save Roe, but in terms of a more expansive vision for the future for our communities?
I can start. I mean, I think that one way to answer that is to continue the thread of the mutual aid discussion, which is, and maybe to like link it back to what I was saying earlier about Roe being a negative right, you know, the right to privacy being like, okay, the state will stay out of your bedroom, or, you know, keep the state off my body, kind of these political slogans. If we were to build a world in which the reproductive justice tenets that Prof. Luna mentioned at the beginning in her intro could be realized, you know, that would require a very different, that would require a very different role for government. It would require a very different kind of distribution of wealth and power and resources than we have right now. And so I think it is, I don't want to minimize the impact, like sort of the severe and deadly impact of the Dobbs decision. And I also think that, as you put it in the question, you know, Roe has disciplined our imaginations for so long that in some ways this is a moment to go beyond what it put in place, as you know, sort of frame the question. And one thing that I've been thinking about a lot in the wake of Dobbs is how even before Roe, abortion rights activists, you know, from a variety of social movements, some involved in Puerto Rican nationalist movements, some involved in Black Power, some involved in radical women's liberation, they all had a vision of abortion that greatly exceeded what Roe put in place. Oftentimes, especially socialist women of color, paired the right to free abortion on demand with the right to be free of sterilization abuse, of the right to have the resources, available to raise as many children as they might want to have. We have historical touchstones that I fear get erased by the disciplining of Roe, that I think can be really helpful to amplify in this moment, that are, certainly precursors or share important threads with the reproductive justice tenets and the reproductive justice movement as it is organizing today. And so I think finding those, reminding ourselves of the political imagination of activists that envision something much broader than Roe ended up delivering in a moment where it is possible for us to either return to that or go greatly beyond it, can be a really useful way to kind of root ourselves and have courage to think much more broadly than what the last 50 years have managed to provide.
And I'll just say, and you can tell that both of us are really into history and archives, and it's always amazing, right, to be able to look at something from the 60s, 70s, and see people just had such complex analyses that also within movements, people can sometimes forget that, right? And it is not to say that the law is not important and doesn't have a role, but putting all one's energy into law is really limiting for so many reasons, practical and financial, and also movement-wise, right? When you think about, for many people, what they're thinking about on the day-to-day at a very practical level, like paying their bills, basic healthcare, getting to see a doctor maybe once a year, wouldn't it be lovely, right? And I think in moments of crisis, particularly in the beginning of the pandemic, or we also saw this in the US in 2008, 2009, right? Where there's these major disruptions and people realize, wait a second, I'm not necessarily protected. I thought I was okay, right? And realizing just what it means, right, to rely so much on sort of benevolent legislators, benevolent governments, and benevolent employers, as I sit in my office, right, to provide your health care. Because what happens when your job is gone? And unfortunately, right, that very harsh reality, and it's not just people in certain types of jobs. I mean, even right now, tech sector, right? People are whoa, wait a second, tech sector is just getting slammed. And what does that mean when your healthcare is so tied to your employer at a very basic level, your kids' healthcare, your parents' healthcare, right? And so it doesn't take that much sort of imagining in a way in those crisis moments, right? Which is why I think you then saw, right, people being wow, mutual aid in general sense. But also we saw very interestingly that the government could figure out pretty quickly how to get people cash infusions so that they could purchase things to keep this economy going, right? And so we also could just look to a couple of years ago, right? Wow, it is possible to do some different things. It's not just something that can happen in small Nordic country, right? It can happen even in a very complex, heterogeneous, sometimes increasingly fractured, according to some, society. And I think that people need to take that moment and continue to think, oh, wow, what would it take for us to be able to say, yeah, we as humans who are living in your nation deserve some support, deserve, right? And not with like hundreds of strings attached, like just at basic subsistence level, right? We deserve some capacity to take breaks. We deserve these sorts of things and capacity to have healthcare. And then think locally, like, yeah, okay, what would that take? I think that's one of the questions someone had. We can get to that later.
Actually, let's get to that now. So just a reminder to those of you in the audience that we are taking questions in the Q&A section at the bottom of your screen. So please feel free to post questions for the rest of the talk. And so picking up Laura's question, how can we move the political discussion from restoring or codifying Roe to talking and hopefully enacting the tenets of reproductive justice? And in advance, the panelists offered some of their favorite resources for you, the audience, to check out, and we'll put that in the tab in just a couple of seconds. But while that is there, I wanted to invite both Professors Luna and Professor Matthiesen to maybe discuss, what do we need to do? What can audience members do on the ground in their local communities to help advance reproductive justice?
I mean, I think there's a lot of things people can do, and I do want to acknowledge the question asked about the sort of political discussion for restoring and codifying Roe. And I think it is important to distinguish between sort of levels of discussion that are happening. I think that there are many folks that, for various reasons, and again, not downplaying the impact of Dobbs' decision, right? And also, right, understanding that like Roe is extremely limited at the time. There were lots of folks who weren't happy with it, including activists on the ground, legal scholars, I mean, just a whole set of folks, right? About the sort of that win. And that then again, counter movement mobilization, like restrictions were immediately, right? So there's people who've been living in a like, let's say post-Roe reality for a very long time, right? In which abortion was ostensibly like inaccessible to them. And so, well, yes, like there is space for that. It's also that though, like, yes, there needs to be space and acknowledgement for all these other efforts that are happening, that people are doing things at their city halls to figure out abortion funding and city budgets, right? Along with childcare funding, along with increased maternal health funding, right? Like that, all of that could go in there, right? At the very city level, right? Showing up for your city council meeting, just like people, quite frankly, who oppose abortion have been doing for decades, right? So it's not just about the federal level. It's like, what discussions are happening at the school board level about reproduction? And we know that is a very fraught area based on the work of many scholars. And yet also like that's a space of intervention, right? Because what people even know at a basic level, like I teach repro and students, they know, right? Like that they are not getting, their full education, and that there's a human right to education, right? And that includes education about your body, family possibilities, right? There's all these different ways, different organizations and initiatives are doing this work. National Network of Abortion Funds, has all sorts of things that are happening in different spaces. Some of the same folks who are doing diaper drives or doing abortion fund, right? Like recognizing that these are all part of the same reproductive spectrum. So those are examples of things that people are doing. And Professor Matthiesen, you can add to that.
I think, I guess the way that I think most about this question is in terms of, there was a breakthrough moment, I suppose, that the pandemic created in terms of talking about it get framed as the in the language of care, but I think we were really talking about reproductive labor for the first time as like having a national conversation about labor that is usually invisible, either because it's like, quote unquote, a labor of love, like you just take care of your loved ones because love is like this infinite resource that just keeps you going forever and ever. or it's invisible because it is outsourced through into a racialized and gendered, grossly underpaid workforce that labors inside of other people's homes to take care of the reproductive labor of parents who, you know, have white collar jobs. And so there's like this, I think the pandemic made this moment happen where all of a sudden we were talking about this supposed seemingly new kind of work that especially socialist feminists have been talking about for decades and decades, and just how important reproductive labor is, or this idea of social reproduction, that we need to reproduce ourselves, and we need to reproduce the public kind of resources that are necessary for a functioning society, that is often historically and continues to be gendered and racialized work that is deeply undervalued and often not seen as work at all. And so, you know, I think that is a really important opening for anyone who wants to kind of move to imagine beyond Roe and abortion and think about the right to have children and raise them with dignity in safe and healthy environments, because that we need to first see that as valuable if we are going to like achieve those RJ tenets. And in DC, for example, you know, there's been a very successful campaign called Under 3 DC that is trying to get universal daycare for any child under 3. There's a plan to sort of like build that out to even older ages for universal kindergarten. So finding those kinds of campaigns and making the connection to, you know, I don't think the Under 3 DC campaign necessarily uses the language of reproductive justice, but that is definitely an art, like that falls right within the reproductive justice framework. And so making those connections clearer in political discussions, I think is one way to kind of expand our horizon. And I really liked the example of like doing abortion funds and diaper drives, or like, you know, full spectrum doulaing, anything that illustrates the spectrum of reproductive experiences and decision making that doesn't like artificially silo not having children, abortion and contraception over here, having children, pregnancy, raising, you know, creating a family over here. The more that those initiatives can illustrate the reality and complexity of reproductive experiences, I think is really, really powerful and useful.
Great. So one question we've got is a request to discuss the relationship between reproductive justice and the intersection of reproductive justice and reproductive rights with trans rights.
So, I mean, I can take a first go. I think that it is maybe we should be moving towards a place where there is less of that we frame these movements as distinct. Like we should be moving towards a place where we kind of like silo trans justice and reproductive justice. I think would be very positive because, you know, at the end of the day, both movements share a very fundamental principle, which is bodily autonomy and self-determination. And, you know, I was listening to a webinar with Chase Strangio and Kiara Bridges at UC Berkeley hosted. And I thought that Chase Strangio put it very well, that like we all have sexed bodies, and in order to have like the full range of life chances, we need to be able to have determination over what our sex bodies do and become and engage in or don't. And sexed bodies are historically and continue to be a major vehicle through which the state enacts violence and control. And so it is a battle that, reproductive justice and trans justice advocates are already engaged in. And I think that they're, rather than, you didn't frame the question this way, but if people have been following the very frustrating rhetoric around this issue of, trans rights distract from abortion rights, I think that is a really harmful and unproductive way to even, and an inaccurate way to even have a conversation about the relationship between those movements, because there is a lot of space to engage in work that is tethered by the goal of self-determination over one's body. Those are some initial thoughts.
Yeah, and I think it's also helpful to look at what's happening in many places on the ground. And I mean, it's been great to see, like, over the time from when I started research and around reproductive justice, and then as I got more involved in actual activism around reproductive justice in very specific ways, to see also, right, the increased understanding, right? Because movements also have to do learning themselves, right? Movements are composed of people. People don't come with some pre-created list of all the insights that are going to be coming in the next 30 years. Like, that's just not how that works, right? There's continual learning happening across movements, in movement spaces, at the individual level, at the coalition level, and state levels and federal levels and international levels, right? So even within conference spaces, to see, right, the shifting understandings and moving from necessarily things being like a separate workshop or something to actually being like, oh, part of even how like the forms are created for a thing, right? Like that is part of the shifting that, well, also, yes, like people wanting to have workshops, great. And also like how things are being structured in particular conference spaces, right, makes a difference, right? When you think about everything from gender expression to disability, right? You think about religious practices, like how is that actually integrated into the movement practice? And I will say sometimes when I see discussions, and it depends really where the space is, like online is a real space, and also online isn't the only space, right? Because like sometimes I've literally been at a conference that's happening and I can see a set of people having a discussion online that seems very abstract and disconnected from what literally is happening in the conference, where people are actually actively doing a set of things and having discussions, and yes, also sometimes having conflicts, but also working through those conflicts. So I also think it's really important for people to keep that in mind. And it's not always possible to be in those movement spaces. I understand that's not possible all the time, but continually, both in my research and then just, in general, people who are like going to the space like, oh my gosh, wow, this is so amazing. Like, what's it like to be in a conference or a physical space for a little while where people are like acknowledging identities, experiences, there's childcare, there's food, particularly at reproductive justice, there's food, right? There's acknowledgement of people's embodied experiences, there's breaks, there's all of that. And that's why like those spaces where it's actually happening in practice, even when people aren't always able to articulate certain things, like you're able to see it like, oh, this is what people are trying to work towards at a much larger level, right? So I'd also just encourage anybody in the audience to try to get to those spaces.
Thank you so much, both of you. We're rapidly approaching the time to wrap up. So I'd like to invite you both, if you have any final thoughts you'd like to leave the audience with today, And then we'll transition back to Felicia for the closing.
I can start if you, I guess just to return to your question, you know, there is now this very helpful resource sheet that is in the chat. And something that I've been thinking about in terms of like the response to Dobbs and what should people do, something that I guess I didn't get to in my answer is like, I think that it's really important to kind of assess where, like, what skill set do you have that can be of most use? And like, what is your comfort level with different types of activities? So I'm thinking about this because I was on a panel last week that was a fundraiser for DC Abortion Fund. And we all kept saying like, donate to abortion funds, which is also, I think, what everyone has been seeing and saying since Dobbs. And that is obviously incredibly important. But I also think that donating in any other context, like if the state had not retreated from abortion care in such a severe way, in any other social movement context, donating would be considered a fairly passive act. And so I'm not saying that to say don't donate. Obviously, you should donate. But also, I think like something I've been thinking a lot about is how to empower oneself and one's community in this moment with resources and information and kind of take back control over the care of abortion. And so something I ended up saying there that I'm going to say here is, you know, there are a ton of resources now about how to administer medication abortion. Many of them are on this resource list. I think that it is totally an empowering and radical act to either learn with yourself how you might administer medication abortion, to learn with a group of friends, to learn with a group of coworkers. If you have a space where you can organize a training with someone who can teach you how to administer medication abortion, you know, it's a fairly straightforward and safe thing to do in the privacy of one's own home. And I think that that is, you know, in keeping with feminist and queer trans health activisms of like seizing the means of reproduction for our own ends from a medical establishment that has been gatekeeping and exclusionary, from a system of capitalism that keeps resources out of our hands. That can be that, I think that's like in keeping with a very radical tradition that I invite people to kind of experiment with and bring back in this moment. And the last thing I'll say is that there's also networks of people who are, you know, taking immense legal risks to share medication abortions, to mail medication abortions to people who need them. And maybe that's something that like you want to do, to have a thought experiment about, of like, where are you willing to plug in? What are you willing to take on? Just to say that there's like other things happening, obviously, beyond donating to abortion funds. So that's something that's been on my mind.
Yeah, and I do think also the important thing of like taking a moment to think about sort of where you're at, what you're interested in, and the timeline in which you're interested in it. Because movements are long-term. And no matter what happens next, like it's a long term, right? And that means, right, that there's also a lot of different ways that people can engage. Obviously, people on this webinar are also interested in like learning more, right? And so some of the resources that are on there are about just like understanding more around certain histories, and others are around like, yes, beyond donating, but like, okay, can you learn to help staff a phone line around something, right? Can you do this type of thing? Like also like, what's your, you know, capacity for online things, right? Because also people just have different comfort levels. And I will say that I think that's been there is no one right thing to do, right? Because there's a range of people and a range of needs. And I think that is important to emphasize, right? There's many spaces of contribution and intervention, particularly if you're interested in thinking about the long term and helping grow movements and meet movements where they're at and what they need based on the wisdom of decades of experience. And that's the other thing I think is super important when people are interested in getting involved, is like understanding like we're always all learning and there's a humbleness to that. I'm still learning, I'm still learning things, right? And that means like I can be more effective as a contributor by recognizing that I don't have all the answers and there's other experts out there, right, who absolutely do. And I need to also ask them, like, what is it that they need in this moment, right? And there's, the resource sheet that was created, and then there's links to other resource sheets on here for also thinking about the types of thing, because for some people, it's also like, I'd like to buy some merch just to like, when I'm outside, to get people thinking differently, like to raise the question, like that might be your way of doing it. Whereas others might be like, yeah, I want to try to access things medical wise. Like I want to do a range of things. Like it's all needed. Yeah, it's all important. So.
Thank you, Dr. Luna and Dr. Matthiesen, for sharing your time and knowledge with us this evening. And thank you, Dr. Williams, for moderating this engaging conversation. I also want to take a moment to thank Media Services and DSU for technical and remote captioning support. I hope that you all enjoyed this webinar, and I wish everyone a wonderful evening.